Okay.
Okay,
Sorry about that. Please go
so
ahead.
I'm just going to briefly run through this again.
Sure.
The
Sorry
title
about
of
that. Thank
this
you.
presentation is Channel Connections from Saam Medical Meditation, Liver Qi Stagnation, and Autoimmune Conditions. And we are going to be discussing the liver, large intestine, harmonized combination taken from my book, Saam Medical Meditation, which I've been doing for 20 plus years now. And you'll notice on the diagram, there's a liver. Let me share this document. Okay, I think you can all see the document. On the left is the liver, and on the right is the large intestine. These are the 4-point combinations of Saam acupuncture, and I use them together on every kind of liver treatment or large intestine treatment. I do this combination. I just did it this morning on a patient to great success, and it's kind of a very simple thing for you to learn. And we'll talk more about the harmonized combinations in a moment. So we're going to talk about, well, number one, the mystery of acupuncture. As many of you may know, the legendary monk Saam from Korea in the 17th century discovered the mystery of acupuncture after meditating in a cave for 13 years. And the mystery that the monk Saam discovered was qi. He meditated and he could cultivate his garden of qi. He developed an awareness of qi. And that's what we're going to talk about today. So, liver qi stagnation starts with stress. When we think of stress, and when I coach my patients, I tell them that stress is synonymous with liver qi stagnation. Now, we all know the function of the liver is to move and circulate qi. And it also, as well as other things, moving qi and blood. And it's also responsible, it's the general, considered general for harmonizing all the other organs, keeping everything in harmony. Well, stress can come and first affect these liver functions. And from stress, 1,000 different disorders can occur, and that includes autoimmune conditions, also includes pain. The simple explanation of pain is liver qi stagnation or qi stagnation. Okay, now the first thing, this is I do meditation. I coach my patients. I teach my patients to meditate on the acupuncture points. I recruit my patient's mind with the treatment. So we're going to involve our patient's mind with the treatment. Now, in regards to basic stress and basic simple liver qi stagnation, I want to bring this first diagram up, and it's the picture that you see of the head, and it says stress. And you'll notice at the top of the head is do 20, do acupuncture point number 20. And this is the termination point of the liver channel. So I coach my patients that they have stress up here, specifically at do 20. So along with my Saam acupuncture point prescriptions, I'm also going to do 20. Each treatment, I may throw in other various points depending on the condition. So do 20 is one that I'm using almost all the time with the harmonized combination. So the first area of stress that I identify with the patient is at do 20 at the top of the head. And I coach them and I say, this is an area of stress or qi stagnation. And then and I've already coached them. We're going to move that qi. We're going to recruit your mind to move it to these faraway points on the Saam 4-point prescription. And the meditation points, I'm going to back up for a moment. The meditation points are the tonifying points, the chief tonifying points of the liver or the large intestine. The tonifying points on the liver junk yolk are kidney 10 and liver 8. So I may be coaching them that those are the chief points. I want them to bring all their mental meditational focus to those points during the treatment. Now, if I'm accentuating the large intestine, then I'll bring their attention to large intestine 11 and stomach 36, the two tonifying points on the large intestine technique. So I've already put the needles in, I do 20 in, and I'm going to do also the front mu points. I'll show you that in a moment. And so I've already brought their attention to that. We're going to meditate on these chief tonifying points on the Jung-Gyuk techniques. So then I go and I say, okay, let's go to do 20 here. This is the termination point of the liver channel. We have stress up here, and they may not even know it. Sometimes I say, if they don't have stress, they say, oh, no, I don't got stress, or the pulse is pretty relaxed. Then I say, okay, let's pretend that you have stress here, because maybe you probably do. Everybody's probably got stress up. So I'll say, pretend that you have stress. And I've already coached them that stress is synonymous with chi stagnation. So pretend you got stress or chi stagnation up there. Now, I've also coached the patients on where the mind goes, so goes the chi. Can y'all throw out a yes or no if you've ever heard that in the chat? Who has heard of where the mind goes, so goes the chi? Can somebody just type yes, no? Great, we're getting a bunch of yeses. So you've all heard this. Where the mind goes, so goes the chi. And this is really a foundational statement of this technique, is that allows us to recruit the patient's mind. We're going to use their mind to move the chi. So that's great. So we've identified to the patient, we've coached them that they have stress at do 20. And that's going to be one area where they can take the stress and move it to the tonifying points of the Jung-Gyuk technique. Now, the other area of stress, I just changed the diagram. It's going back to this diagram of the liver, large intestine. Can you all see that? Because the second area of stress that we identify, or where the chi stagnation occurs, is at the front mu points of the liver. Now, right now, we're just talking about general basic stress. So we got general basic stress at do 20 top of the head, but then we also got at the front mu of the liver 14. And so quite often I also use the front mu of the gallbladder. I just kind of throw them, we're identifying this mid-torso area. So then I identify to the patient, oh, you also got stress here. So we got two areas at the top of the head and this middle torso area. So that's where I want to start right now, just on a basic, simple chi stagnation stress treatment. So what do? We got the needles in place. We've just coached the patient that they're going to identify these areas where chi stagnation stress occurs. We've coached them to bring it to the tonifying points that we use. Now, this is the technique. I do a 3-breath technique with the patient. And during the 3-breath sequence, we're going to stimulate the needles. And so based on the basic tonifying breathing technique, tonifying sedating technique, it's when the patient holds their breath and exhales that we're stimulating the needle. So I coach them to do a 3-breath sequence, and I have them breathe in through the nose, and then I have them hold their breath. And when they hold their breath, I'm spinning the needles and I'm saying, connect, bring that chi stagnation to these 2 points, send everything to these far away points. So we're recruiting their mind. They've identified top of the head, the middle torso area, and they're connecting that chi stagnation. They're moving it with their mind, and it may be to the liver technique, liver 8, kidney 10, if you're focusing on the liver, or if you're going to change your focus to the large intestine, you can do it on large intestine 11 and 36 on the right side. So for 3 breaths, I have the patient do this. They breathe in as they're holding their breath. I'm spinning the needles clockwise, ideally to the count of 9, 1, 2, 3, 1, 2, 3, 1, 2, 3, spinning clockwise as they're holding their breath and exhaling. So I do that for 3 breaths. And then I coach them during this time as I'm spinning the needles. I'm going to coach them that for the duration of the treatment, as they're lying there on the table, to do this 3-breath sequence on their own every couple minutes. So I definitely make sure that they've got it down, that they're going to hold their breath and exhale every couple minutes, 3 times, to reconnect, bring their meditational focus to these far away points. And then I even give them this as homework. So I tell them, do this at home. Whenever you get a chance to relax, lay down, pretend like the needles are still there, and you can still do this breathing meditation and just pretending the needles are there. So I give them homework to do. Now, we're recruiting their mind. We're actually putting the responsibility on the patient. We're getting them involved with their treatment. I like it. I mean, it gives them, it takes the responsibility in some kind of way from me and puts it on the patient. My treatment philosophy is to give the patient control over their health as much as possible. So this is a technique where they can take it home with them and meditate on these acupuncture points. So let's now, like, you're in the clinic and this is a diagnostic conference. So now we're going to kind of go a little more into liver qi stagnation and stress and things that you can pick up. And it's particularly in regards to constitutional patterns. I think we're all very familiar with like trying to identify a person's constitution, although it is a very imprecise art. It is an art. And I like with Dr. Ekman in, I forget which book it is, maybe it's The Complete Acupuncturist. It's really funny. He wrote something and he said, I've been diagnosed by acupuncturists. I've been diagnosed with every constitution there is. So it's funny because it's an imprecise art to determine a person's constitution. And yet it's a very kind of fascinating art to practice because we're looking at the patterns, we're detectives, we're picking up clues, trying to determine a person's constitutional pattern. And that's the beauty of Saam, is that when you can pick up on a pattern or constitution, it's like an aha, I got it, I figured it out. We're going to do this, we're going to do the heart, we're going to do the liver. And it's just a wonderful thing and it fits. And you can really get the most fascinating treatments. And it's really kind of also about where the qi energy is at the moment. And that, like a qi energized channel, this is more with the interpretation of dreams. I did a lecture a couple years ago. Interpretation of dreams is also a constitutional kind of pattern. It's a piece of a constitutional pattern where in the dreams we can determine if a dream has an organ energized theme to it. So that one, for instance, what would be a liver kind of dream that may determine a constitution? It could be person flying, levitating. The liver is in Saam acupuncture, the liver is at the third level of human needs. Are y'all following me? Do you all know the 3 levels of human needs of Saam acupuncture? Can you throw out a yes or a no in the chat box? The 3 levels of human needs. Good. Got some yeses there. Or is anybody not familiar with the 3 levels of human needs? Okay, we got quite a few no's coming in. Okay, let me do a quick review of the 3 levels of human needs. And these needs are correspond to Saam acupuncture channel, organ channel. The first level of human needs is the need for food and material possessions. The need for food pertains to the spleen. Now, it's not just I need food, I'm hungry. It is also the provision of food, and it deals with historical food insecurity. It's the responsibility of providing food for others. So that's the level 1 need for food and spleen, and you can understand where worry and overthinking comes from. When there's food insecurity, that level 1 need really comes, and there can be manifest worry, and that's a spleen channel. The other level 1 human need is the need for material possessions, which is the establishment of a home, homeland, tools, and the people of your community. This pertains to the lungs. So that's general rundown of level 1 needs. And these you can identify in dreams. We're not going to talk about that in any detail today, but you can identify these themes in dreams. And if you identify, then you can say that's a qi energized channel in that dream. And guess what you do when there's a qi energized channel? You use that qi and move it to promote growth and healing. So when the qi is energized, the whole theme of acupuncture is to move qi, because qi promotes growth and healing. It's a propulsive force of growth and healing. So in the dream, there's a lot of qi, and you want to capitalize on that and move it. particularly within 24 hours of the dream or within 12 hours of the dream. I find the chi energized channel lasts about 12 hours after the dream. So that's a great time to use acupuncture or meditation on it. Okay, second level of human needs is the need for relationships. That loving family friend, platonic, or spiritual relationships pertain to the heart. Sexual relationships pertain to kidneys, but it's not only sexual relationship, it's also relationship to self, and that pertains to kidneys. In a dream, in regards to that, somebody may have a dream that they have a funny haircut, they've dyed their hair, something about their appearance has changed. So that would be a kidney energized channel dream if it's not explicit, like sexual activity going on in the dream. Relationships, heart relationships, spiritual friend, loving family, they can be good, but a lot of times they're bad relationships, or not all the time, but sometimes relationships are bad, and that would correspond to demonic possessions, hauntings, and so forth. And we would want to expel the demon possession, hauntings with maybe a heart, gallbladder, B+ channel treatment. So those things will come up in dreams, dreams of family, friend, pets, spiritual, miraculous things can occur in this heart level area. I call it the Xiaoyang realm. It's the gallbladder Xiaoyang, which pertains to the heart, and the Sanjiao pertains to the kidney. The Xiaoyang realm is where these weird synchronistic events occur, supernatural events in the Xiaoyang realm, which is heart, gallbladder, kidney, Sanjiao. Going now to the third level of human needs is the need for recognition of one's skills, talents, achievements. That could be in the realm of performance, like an actor or an athlete or a politician, and that corresponds to the liver. But in general, it's also managerial control over others. And since we are talking about the liver today, this is an area where you may identify and diagnose a patient where they are managerial control over others. I always ask, do you have managerial control over other people? And they say, oh, yes. And then you're on the right track because they probably got a lot of stress. Where does the stress come from? It's great to have managerial control over others, but the problem is that you're the boss, but the problem is the people underneath are not doing what you want them to do. And how does that manifest? It can manifest in anger and frustration. I like to really use a metaphor of liver chi stagnation as you have an important meeting to get to, but you're stuck in a traffic jam. And how does that make you feel? Stressed, angry, frustrated. So that's classic liver chi stagnation. So that could be the patient's constitution. It could be coming from, their responsibilities. The other level 3 need is the need for accumulation of knowledge, which pertains to the pericardium. This is the study, but also in performance, the teaching of knowledge to be an influencer. So influencers operate in this level 3 human need, liver or pericardium. So in picking up on these pattern pieces, diagnosing a constitution, you may determine that your patient is in this liver constitution area, being the boss manager, and it's maybe obvious you've already detected their stress and so forth. Another physical feature I look out for with liver constitution is a flared rib cage. So when they lie on the table, you may see like their seventh ribs flaring out of the chest. And that's kind of another, that's a physical constitution of a liver person generally. Has anybody heard of that? Are you familiar with the flared rib cage associated with the liver? Can you type a yes or no there in the chat? Are y'all following me as well? No, nobody. Okay, so yeah, this is something I keep an eye on out for. Probably, in Toby's presentation, he goes into these kind of constitutional environmental factors. But this is one when I lift up a shirt to do like the mu points and I see the ribs flared out, that gives me an indication that, oh, it can be lung too. Okay, wasn't aware of that one. I thought the barrel chest, maybe it's like the lung is also at the upper chest. It's like a upper barrel chest maybe. But this is like the lower rib cage is flared out a lot of times. And you'll see it, and that could be an indication that this is a liver constitution person. Now, um, so now what's also interesting is non-alcoholic fatty liver disease. I get I get a few of these. I've had a few of these, and they get diagnosed with fatty liver disease. And the first question is, I don't drink alcohol. They don't drink alcohol. So it's like, well, where is this coming from? And if they got diagnosed with non-alcoholic fatty liver disease, they're probably a managerial control over other people. They're probably in this liver constitution realm. So that's something that you can kind of delve into as far as determining a constitution. And it does, in stress is where everything begins from stress. Now, from stress, 1,000 different conditions can arise. Autoimmune conditions, autoimmune health, digestive problems, epigastric digestion are huge with stress. So we're going to go now into the graphs. Let's see here. Okay, let me pull up the next graph. Test. Okay. So this is a pictogram from my book on the headache section of my book. And I'm going to kind of talk about the harmonized combination development. So liver, I do on the left side, and large intestine on the right. And this is from when I was in school. I was a student of Dr. Tae-Chung Chu. And he generally taught me that when we have a female patient, we do the Saam 4-needle technique on the right side. If there's a male patient, we will do the Saam 4-needle technique on the left side. So I started that, but I immediately kind of went into this harmonized combination. Now, why do we do men on the left and women on the right? Women have more blood than chi, in theory, and what we've been taught. And the right side pulses pertain to chi. Spleen, lung is the right side pulse. So the lung and the spleen correspond to chi. And therefore, we always want to tonify that which is deficient. So if women have more blood than chi, or they are generally more deficient in chi, we want to tonify that which is deficient. So we choose the right side for women. The men have more chi than blood, and the pulse on the left side is the heart and the liver. And so these are blood organs. So men are generally more chi strong and blood deficient. So we use the left side to do men and on the 4-needle technique. So then I came up with this harmonized combination where I generally break it down, and I use on the it's not even men or women at this point. I use the yin channel on the left side, and I use the yang channel on the right. So the harmonized combination, this liver, large intestine, comes from the trigram, the trigram of the pivot, closed, open channels. And the second line of the trigram, it's been a long time, so I forgot the source of this. Maybe some things are so kind of, you take them for granted, especially after you've been practicing for a while. Like if you have to take a board exam, there's going to be trouble if it's been like 20 years. So I don't know, I forget the source, but somebody can remember the trigram of the open. Like the first line is open, it's the Tai Yin channel. Second line is the Yang Min, it's a closed. Third line is Shao Yin pivot. Fourth line is Tai Yang open. Fifth line is the Joy Yin closed. Sixth line is the Shao Yang pivot. So this liver, large intestine corresponds to the second and fifth line of the trigrams. Joy Yin corresponds to the Yang Ming channel. So this is the basis of the formulation of the harmonized combination. This is also derived also out of Dr. Tung acupuncture. He will incorporate this as well as Dr. Richard Tan. We're going to go into some Tan Tung combinations in a moment. So anyway, for people that are wondering, where do I get this liver, large intestine harmonized combination? It's from this trigram of Joy Yin corresponds to Yang Men. So liver is done on the left, the yin channel, tonify that which is deficient, and the large intestine yang is done on the right. So this diagram here is from the headaches, and you'll notice that now let's talk about TMJ because this did now. Let me explain this too. This is Dr. Richard Tan and the balance method also application. So I use Saam acupuncture in diagnosing a problem. I use Dr. Richard Tan to help me along the way. So for instance, this is balance method number 2. Let me get this. I can see it in small detail on my screen. Bigger picture. Okay, this is balance method number 2. Now, balance method number 2 in Dr. Richard Tan means that you can treat an either-sided problem. Now, let's pretend, and this is very common with stress, is TMJ. So say somebody has a TMJ problem. You can say, okay, that TMJ problem, it's either on the large intestine or the stomach channel. But we'll say we're targeting the jaw, and you'll see the jaw corresponds to the large intestine channel. So say there's a problem on the jaw. Say it's a right-sided jaw problem. Well, we can use the liver, large intestine, irregardless of what side the jaw problem is on, because whether the problem is on the right or the left, balance method number 2 means we can do the liver, and the liver is the channel that targets the jaw, the large intestine channel. Once again, the jaw corresponds to the large intestine channel. And the balance method number 2, I'm using the liver channel on the left side, but it doesn't, I can target a jaw problem on the right or left side. It doesn't matter with balance method number 2 because it's an either-sided problem you can target with this large intestine. Now, in regards to TMJ, I use this a lot because TMJ is also associated with stress. There's a lot of muscle tension. And I just wanted to ask if you all do stomach 7. This is very common for TMJ. Do you do I call it kinetic because when I do TMJ, I do stomach 7. You open the jaw and you find the hole, you put the needle in, and you make sure that it's not painful. And then I have the patient open and close their jaw 10 times. So it's a kinetic muscle balancing technique. I'm just curious, is anybody familiar with that for TMJ? Can you type a yes or no? Just 2 points, stomach 7, left and right, and then you just open the jaw 7 times. No. Okay, so this may be something you want to try in the clinic. So yes, good. Somebody says yes. Okay, so that's something that you may have learned today. Now, TMJ also has muscle tendon pathology. There's some tight muscles, could come from tight neck muscles, tight sternocleidomastoid muscles. So you may need to do some muscle stretching with that. But irrespective if it's not a muscle problem, it's coming from stress. And this liver large intestine technique can target TMJ. So if you get a TMJ patient, you can do this liver large intestine technique. So that is kind of the construction of the harmonized combination. Joy Yin channel of the liver corresponds to large intestine Yang Men. And now going on, okay, I'm gonna pull up the next thing here. Okay, I know it's a little complicated, but can you all follow along with that? So the theme of today's treatment is channel connections. And first is the construction of the harmonized combination using the liver and large intestine. Now I add another channel in the mix, and it's based either off of the circadian clock, opposite of the circadian clock, and that's what this is here. So we're going to go through each one. Now, what I want you to notice is the mu points. For this one, if you look at all the mu points, you'll see the front on the left picture for under male, you'll see the front mu of the liver, the front mu of the large intestine, and the front mu of the small intestine. So notice that area. You can target intestinal digestive problems with this technique very well. So on the male side, and I don't really distinguish anymore between male and female. Quite often I'm doing, it doesn't matter. And I'll try to explain that later, but we'll break it down. On the male side, what do we got going on here? On the left side, you'll see the liver 4-point prescription. The 2 tonifying points at the left knee, numbered 1 and 2, the 2 sedating points, number 3 at the foot and number 4. That's the left side 4-point prescription. On the right side, you'll see the 4-point prescription of the large intestine. Number 1 is large intestine 11. Number 2 is stomach 36. But then you'll see number 5 on the right wrist, and that is the front mu point of the small intestine. So then you also see you'll see the lual connecting. That's the lual connecting of the small intestine, which happens to be number 5 on the small intestine channel. So here I'm including the circadian clock using the opposite, and this corresponds to Richard Tan technique number 4, where he includes opposite circadian clock. So here, what's good about Richard Tan on the circadian clock is this is another one like the number 2 balance method number 2 and number 4. This is number 4, the circadian opposite, where you can use either sided, which is much more flexible. So say I've got a small intestine problem and it's all located on my left side. Well, I can still do the liver on the left side and I can target it because I can, if the problem is either on the left or right, I can still use the left side large intestine. Say it's a neck problem or a back of the neck on the small intestine channel. Doesn't matter if it's a left or right-sided problem. I can just stick with this harmonized combination using the liver on the left side. So this is derived from the circadian clock. It's the opposite 12 hours out. Whatever the channel is 12 hours out from the circadian clock is the channel that we can incorporate with this technique on the harmonized. So it's the small intestine is 12 hours out from the liver. The liver time on the clock is between 1 and 3 in the morning, and 12 hours later is the small intestine between 1 and 3 at night. So if you identify a problem on the small intestine channel or intestinal borborygmus, you can do this liver large intestine treatment. And it's great because you're also doing a large intestine, you're doing a full intestinal treatment with this technique. Maybe it's from stress, probably is. Now for the female, the chief technique, the yang channel should be the chief for women. So we're going to use just only 4 needles on the right side, and it's large intestine junk yolk on the right side with the liver on the left. But on the left side, you'll see this other point, number 5, which is down there, it's kidney number 3, which is the lual connecting point of the kidney channel. And it just so happens that the kidney channel is 12 hours opposite the large intestine. The large intestine is from 5 to 7 in the morning, and 12 hours later, 5 to 7 at night is the kidney channel. Now, this is becoming a very favorite treatment of mine, using the large intestine as the chief. And that's how I kind of distinguish in the treatment. I just told you now I'll do the liver, large intestine, doesn't matter, man or woman, and I may throw both lual connecting points, and quite often I do. I'll do the mu of the small intestine and also the kidney. Doesn't matter, I throw them, or both lual connecting points. So it becomes now, it's more than just a 4-point technique, even on the left side. But it's when I think you can do it more than just 4 needles, because when we do the meditation and you're stimulating the needles, I think that's more important, that you're going to really stimulate those needles, the 2 junk yolk points, and it's not going to interrupt with the flow of anything, even if you got an extra point down there, if you want to, just include everything at once. So it's kind of like we're just directing our mind to the chief points, and that's going to override any kind of, what you may say, channel confusion or needle confusion by adding another point. So So this large intestine liver treatment, and also, hey, you know what? Doesn't have to be, maybe it is a male. I'm gonna use the large intestine as the chief for the male, depending on what the conditions are. Now, generally, that's not the case. Usually, if it's a male, my focus is on the liver as the chief, although I may also throw in a front view of the kidney during the treatment, even though it's a female treatment, or vice versa. If the large intestine, it's a female, um, I do the large intestine as the chief, and I throw in the small intestine as well. But what this is neat with the liver, large intestine, and the large intestine connects to the kidneys. And you can get almost a whole body treatment and hormonal system treatment with the large intestine. In regards to immunity, number one, large intestine drains damp. Number two is that the large intestine in 11 and stomach 36, and we learn acupuncture point energetics. Both these points are major immune function points, immune regulating points, major implications for immune system. Of course, they have very broad applications. They're like numerous applications, but both of these are indicated for immune health. So I'm not going to go into the details of the Western physiological of liver, immune health, large intestine, although both organs do have a critical role in immune health, regulating tolerance, where you're preventing the liver prevents autoimmune conditions by keeping things tolerant. It tolerates food antigens that the body needs, and it keeps inflammation from developing. Well, when stress comes, that tolerance goes, and there's inflammation, bowel disorders, and so forth. So with this large intestine, liver, we're targeting, like, we can target the whole body. If you throw in the kidney there, then you can target the genital areas because the liver channel runs through the genitals. Kidneys dominate reproductive health. You run up through the neck, thyroid, stomach, large intestine channel, and the thyroid. And then you got that point due 20 at the top of the head, which large intestine, because it's a Richard Tan balance method number 2, you can connect large intestine and it connects to the termination point of the liver channel at the top of the head. So I've been just doing this and loving it. It's a whole body kind of treatment with this large intestine liver channel treatment. Now, what also is very interesting in regards to autoimmune conditions is that females by far have far more prevalence of autoimmune conditions than men do. So, for instance, lupus, women 9 times more common in women. Sjogren's syndrome affects 95% of women. Hashimoto's thyroiditis affects 95% of women. Multiple sclerosis has a higher prevalence in women. And there is some things, maybe it's the double X chromosome, hormones, estrogen plays a role, hormonal shifts, environmental factors, sexual abuse, those things can increase stress, which can lead to immune conditions. So it's what's really interesting that with autoimmune conditions, we have the large intestine as the chief on the right side for females. And we have these 2 major immune system points, large intestine 11 and stomach 36. So guess what? That in itself will say, okay, I think I'm going to do a large intestine treatment. And then the liver itself also has major immune system function problems or functions. So that's just using these harmonized combinations, you can channel connect to any part of the body. And so any part, if you can, you can use these harmonized combinations combined with Dr. Richard Tan and tongue balance method applications. Y'all there with me? I know that was pretty complicated. It actually came across a little more complicated than I imagined it. So I got it all in my book, and I hope you can follow along. Now, there's another application for this. And we just showed you how we utilize the circadian opposite clock incorporated with this harmonized combination. Well, we can also, thanks for that comment. I'm glad you're able to follow along. So thank you, Claire, for that comment. So now we can also consider using the yin-yang combinations. So we got, what do we got here? Harmonized combination, liver, large intestine, and we're incorporating the lung. Okay, so we're going to look at this one on the right side. We're going to look at the picture to the right, where you'll see in red it says large intestine. Oh, question from Bikshna Gwen. Do you tonify or sedate the Lua points? Tonify. I generally tonify. And what's interesting is I'm very rarely, I will sedate the sedating points during the breath technique. Like I said, on the 3 breath, when they hold their breath and exhale, I'm spinning the needles clockwise, 9 in increments of 9. But when they take that breath in, that's a sedating time when they're inhaling. So as they inhale, I will sedate the sedating points of the technique. So that brief moment when they inhale, I will go to the sedating points and sedate them. But then as soon as they hold their breath and exhale, I'm going to spin clockwise those main chief Jungyuk technique points. Now, I tell the patient, these are the chief points, these 2 tonifying points. They're the most important of everything. You know, I really bring it to their attention to bring their meditational focus. So I think that's why I can get away with, maybe using a needle like the extra Lua connecting point, because we're just really heavily bringing all their attention to these 2 tonifying points. But I will sedate on as they inhale on the sedating points of the Saam point prescription. So yin yang, large intestine is the yang organ and the lung is the yin organ. Again, it's like, this is so basic knowledge, but I can't give you a source. I can get from my textbook, and I forget where it derives from, but it's something I think we're all familiar with. And then on the picture on the left side there, if the liver is the chief, then we can incorporate a gallbladder points. So the liver is the yin channel and the gallbladder is the yang channel. So again, the theme here is channel connections. I love this. I love this one, particularly with the liver and gallbladder, because if you look at the chart there, look at the muse. They're located in this middle torso area. We got the liver on the left. We got the large intestine on the right, and then we got that loop connecting point on the gallbladder in green down there. It's GB 30, 38 or something, 37. But we also got the front mu of that gallbladder. So I love this because this is targeting the middle torso intestinal area. This is an area of stress, epigastric digestive problems, like gallbladder problems, like in today's, diet and so forth. There's multitudes of gallbladder stagnation. So this is another, one I love and I use a lot. And, basically, I'm almost always going to, nowadays, irregardless, I'm almost always going to throw in the front mu of the gallbladder along with the liver, just targeting that area of stagnation. And that's a big area of chi stagnation. So going back to the theme of chi, Monk Saam discovered the mystery of chi. He moved it with his mind. And Tai Chi, Qigong, meditational exercise, you cultivate your awareness of chi. You move the chi with your mind. So this area has a lot of chi stagnation. Yes, I'm needling the points. I'm needling the front mu points. And I will definitely bring the patient's attention to that area as a chi stagnation point. So yes, they're going to be meditating on that point. We're recruiting their mind to take the chi stagnation from those mu points, using their mind to move it to the tonifying points of the liver or large intestine Jungyuk techniques, or both. Nowadays, sometimes it's overwhelming. Like we got 4, like basically to keep it simple, I say meditate on these 2 points, the large intestine on the right or the liver on the left. But sometimes I'm like, I know it's a lot, but if you can do it, meditate on all 4 points. And I'll say the large intestine is the chief. These 2 are the chief, but these 2 are like deputy chief. They're also important. And if it's not too much, you can meditate on those points on the liver channel. But I do kind of emphasize one side as being more important, the chief, and the secondary, like deputy chief, just a little less, still important. And if they can do it, I just say, bring everything out of your head, bring everything out of your chest, bring it to these far away points. I mean, all these points are on the elbows to the fingers, from the knees to the toes. These are far away points. Bring yourself out of your head. I always say to the patient, let's bring yourself out of your head while still in the body, to these far away points. And guess what? You know, what's the result is, what's the goal of a treatment? You know, to me, the goal of the treatment, number one, is offer them comfort and relaxation. If the patient is comfortable and relaxed, mission accomplished, because that's how the chi moves. Chi moves when we are comfortable and relaxed. And I talked about this at the other conference, and I got it in my book. And I love talking about myoclonus. Myoclonus. Now, in regards to chi, and I'm going to get on my acupuncture soapbox, and I'm going to promote chi as a scientific law of nature. And people are like, oh, but the dry needlers, they dismiss it as energy, quote, energy, it's just energy. Yeah, it's a scientific law of nature. It's not regarded as such. It's still yet unregarded law of nature, but chi deserves to be a law of nature. It's a reality. I think it can be quantified and measured. And what's an example of chi is myoclonus. Anybody familiar with myoclonus? You can type yes or no. Myoclonus, one example is that moment when we've all had it. You're sitting on the couch, you're watching TV, and all of a sudden you start to fall asleep, and you're falling asleep. Bang, the body jumps. I think we've all experienced that. To me, that's an example of chi. When we are comfortable and relaxed, the chi as a propulsive force of growth and healing comes to the surface, and it pushes at the boundaries of growth and healing. It almost takes on a life of its own. It's instinctual. It knows where to go in spite of us. But when we are comfortable and relaxed, it comes to the surface and pushes at the boundaries of growth and healing. Another visible example of chi would be for any parent when they watch their infant in their sleep. They have probably surely seen the infants twitching, their limbs twitch when they're sleeping. As far as I've learned and know, a baby's physical growth occurs in their sleep. When they are comfortable and relaxed, the chi comes to the surface, and as a propulsive force of growth and healing, it pushes at the boundaries. And that's the twitching. It's that physical growth occurring because the chi is instinctual. It goes where it needs to go. And it is a propulsive force of growth and healing. It's real. To me, it's a scientific law of nature, but it's not yet regarded. And this may be a point that actually we would prefer to emphasize and accentuate in whatever kind of media battles are going on right now, particularly in regards to dry needle. Now, again, so the goal of the treatment, hey, comfort and relaxation. We're bringing the patient out of their head to the tonifying point. So number one, if a patient's comfortable and relaxed, mission accomplished. Okay, but it's better yet and we've all get excited, and we've all seen it when the patient has the chi responses, when they can feel the chi. And I kind of do a little suggestion a lot of times. I say, oh, you may feel the chi. You may feel something moving, pulsing, throbbing, circulation of warmth in the body. There could be a feeling like an insect is crawling on the skin. There could be a phantom needle, feeling like a needle's at a place where there's not. These are all kind of examples of chi movement. Another one is awesome is when the patient kind of lifts their arms up in the air, their body wants to rise, and they quite often will say, I feel like I wanted to float away. So when patients, report any of these sensations, I'm like, super, like very favorable, like that's super favorable. You responded great. Your prognosis is fantastic, And then I coach them, keep meditating, and I think it's a lofty, maybe impossible goal to achieve sometimes, but I say keep meditating, and you can even feel that, at home when you meditate. Not everybody does, but some people do. And to me, I get personally excited when patients can feel the chi and move it. That's just something that really thrills me. Um, so that is with the liver, large intestine. Now, one other thing in regards to immunity on this chart, the large intestine on the right, chief, you'll see that we're using the lung, the front viewpoint of the lung. So this can now become respiratory illnesses. Um, uh, you name it, coughs, colds, flus, and we're activating the large intestine immune functions of large intestine 11, stomach 36, and now we can target the lungs with this. Now, this is also another guided meditation. Like I'll coach them if it's a lung problem, I'll coach them to mentally pretend like they're descending the cough to the front viewpoint of the large intestine, which is stomach 25. And I kind of like to think of this as we're mentally descending the pathogen where it's being metabolized in the large intestine, at the large intestine, down there. So I kind of coach them to move it down to those mu points at the large intestine. So they're making a mental connection of the lung and, moving the chi down to the large intestine. And with the idea that the large intestine can metabolize whatever the virus or pathogen may be. So I think that's close to concluding of my lecture. I think that's going to do it. So yeah, hey Philip, welcome back.
Yeah, well, thank you for that wonderful presentation, Evan. It's always interesting to hear about your experience using these sort of double-sided treatments. Obviously, using a lot of these clock opposites or same movement um, combinations together. It's really interesting, and we really appreciate your work. Does anyone have any questions for Evan about his presentation? So Evan, I guess I have a question for you. Do you use as every do you use every single sort of clock opposite pair? So there's like I know you use heart and gallbladder sometimes. Do you use things like lung and bladder together and all those different ideas?
Yeah, that's the harmonized combination, lung, urinary, bladder. Um, so it's automatic, like automatic. If it's called for lung treatment, I'm automatically thrown in the urinary bladder. Likewise, heart automatically on the left, automatically thrown the gallbladder. That's just consistently. I do these harmonized combinations all the time. It kind of it simplifies things actually for me. Now, I remember when I was in clinic under Dr. Chu, and we would do like a one-sided treatment, and then on the other side, we'd throw in, like, say we do a spleen channel treatment, 4 needles on one side, and then we do like a stomach 36 or large, Li4 or liver 3 on the other side. And it never really clicked with me, like, as far as like like being in harmony with the theme of the treatment. So that's how I kind of developed this harmonized combination. And it kind of simplifies things for me. Number one, it opens up possible connections, or uh, it's simple, but you can apply it across the whole body in this kind of simple format, even sticking with the yin organs on the left, the yang organs on the right. You can, if you find a problem on the kidney channel, you can make a connection and you say, okay, say there's a kidney chief complaint. Well, my first thought, okay, if there's a kidney chief complaint, my first thought is I'm going to do a kidney Sanjiao treatment. The Sanjiao is the harmonized combination to the kidney. It's Xiao Yin, Xiao Yang channel connection. Now, actually, what's interesting is in Richard Tan, they don't actually use, like, if there's a kidney problem, you're not actually using the kidney channel. I don't think you can, but it's not the first go-to organ. But to me, okay, well then the Sanjiao in Richard Tan is balance method number 2. And it's that channel sharing Xiao Yang, Xiao Yin balance method number 2. And you can use either side. If there's a left side or kidney or right side, I can stick with my harmonized combination, kidney on the left, Sanjiao on the right. And it's vis-a-vis the Sanjiao that I'm actually treating the kidney problem. Now, honestly, I use the same channel. Like if there's a kidney problem, my first thought is, okay, I'm going to first think of the kidney. And well, it's automatic. When I think of the kidney, it's automatic. The Sanjiao is just thrown in with that. But say, like, but there's other things developing and say, well, the kidney channel balances also to the large intestine and there's stress. Maybe it's stress that's causing a kidney problem. So I may say, okay, the kidney is the circadian opposite of the large intestine. So I'm going to do a large intestine as a chief, which targets the kidney, but it also addresses the stress symptoms. And so I'm using a liver, large intestine on the right, but I'm connecting to the kidneys vis-a-vis the large intestine. So there's a multitude of ways you can channel connect to a problem. And it fits. It's cool when you kind of organize all the puzzle pieces and you get the theme, the central theme, and you can fit it in. It's definitely a Saam experience we've all had, and I'm sure we're all going to be talking about in these meetings, like when you find that just perfect technique and everything fits and corresponds. It's a most beautiful moment. It's one of the most beautiful moments of our medicine. Mm-hmm. Dr. Tan's combos. Now, honestly, I don't even know Dr. Tan's point prescriptions anymore. So I just use how he identifies an area and makes channel combinations to it. But I don't even know the Dr. Tan points that he uses. But I'm just using Saam acupuncture to make a connection to the problem where the channel resides on the body.
Okay.
So,
an answer.
Sorry, go ahead, please.
Yeah, it's Lorraine. So you're using Saam to make the diagnosis, then you're using Saam points to make the treatment, but the harmonizing channel, you're using one of Dr. Tan's systems to pick a harmonizing channel.
No.
And then still using Saam points?
Yeah, actually, I would be diagnosing according to Dr. Richard Tan. So say somebody has a left eye problem, okay? And you're like, okay, left eye, that's on the liver. The eye is the liver, right? So, okay, so Dr. Richard Tan says, okay, there's a liver channel problem located at the eye. And that's as far as I take it. Because then I say, okay, with Saam acupuncture, Dr. Richard Tan corresponds with this, but the large intestine is channel connects to the liver channel. So, and it's balance method number 2, which is an either-sided problem. So say, irregardless of if it's an eye problem on the right or left side, I can use my large intestine on the right side and treat either left or right eye side problem because it's Richard Tan's balance method number 2. So I'm using Saam acupuncture in accordance with Dr. Richard Tan's kind of identification of the channel problem, the channel where the problem is, and I'm making the Saam connections to that, kind of following along with his balance method techniques. Does that make sense?
Yes. So you're using Saam's needling, right? You're using Saam's 4 points, but you're using Dr. Tan's thinking about which channel you might choose.
Exactly. Precisely.
Great. Brilliant. Thank you.
You're welcome. Thank you.
So in reality, Dr. Tan got all those ideas from previous Chinese medical texts, whether it be internal, external channels or, the same name channels, or even what you're mentioning, the clock opposites or same movement channels. Those are all from the Huangdi Neijing, and then the
Yeah.
most recent one, the clock opposites, that comes from it's attributed to Sun Se Miao. So it's not even really Richard Tanitz, but yeah, you're
Yeah.
saying that he had
And
that
also,
similar idea. Yeah.
and Dr. Tung's acupuncture also follows a similar line of thinking too.
Mhm.
But yeah, I mean, it goes all the way back.
Okay, wonderful. Yeah, again, I know Dr. Taichung Chu was more closely. I think he studied with Kim Hong Kyung, and I think there's that similarity between them two, those two, in his manuscript and everything. And it's
Yeah,
really great to see you take those ideas to the next level and really advocating for those combination treatments that maybe the older texts that didn't really investigate that much, but I think is really appropriate for some maybe more complicated patients out there. Well, if not, again, thank you so much for coming, Evan. We really appreciate your experience, over 20 years of practicing Saam, and being very active in the Facebook group as well is all appreciated. And thank you for sharing your experience with us.
likewise, Philip. Thank you for all that you've been doing for some too, man. You've been really a big mover in this field. So appreciate you too. And everybody out there, thank you all. And any questions, you're always free to ask.
And then are all those combinations, all the clock opposite combinations, you talk about them in your books, right?
Yeah, they're all in the Saam Medical Meditation book.
Okay, wonderful. Yeah, I keep meaning to read it, but I haven't gotten around to it. But I'm definitely intrigued.
Great.
Awesome. Well, thank you again so much for coming. I really appreciate it.
Yeah, thank you. It's been a pleasure.